So for my presentation, I chose to do Benjamin Rush, who was a prominent figure in both American history as well as the history of psychology. So Dr. Benjamin Rush was coined the father of American psychiatry. He did a lot of work for kind of modernizing the idea of how people think of the mentally insane and trying to bring it to a higher standing. He was a physician, a writer, educator, and also a humanitarian, so he was in many different fields and contributed to many different areas. He was also the first, or one of the first, to kind of see mental illness as a disease, more so than a possession of demons or other such ideas that were common at the time that he was around. Early life and education of Benjamin Rush. His father died when he was actually pretty young. I believe it was 6 years old. So his mother was taking care of him and his siblings, and eventually his mother actually sent him to her brother, Benjamin Uncle's, Dr. Finley, and he became both his teacher and his advisor, as well as his caretaker. So he was in charge of making sure that Benjamin Rush got a proper education to help make himself a name. So education, he was a very well-educated man. In 1759, he attended the College of Philadelphia, where he eventually earned his degree. And then he continued his education in Philadelphia for 4 more years, until eventually he actually attended medical school in Edinburgh, Scotland. And after that, he did return to Philadelphia in 1769 and actually opened his own private practice, as well as he became a professor of chemistry at the College of Philadelphia, where he received his original degree. As I mentioned in the beginning, Dr. Benjamin Rush was a very prominent figure in many different areas. He was actually elected to the Continental Congress in 1776 and was one of the individuals who signed the Declaration of Independence, as you can see on the image at the bottom right corner. So that is pretty cool. He also apprenticed under many leading physicians of his time. John Redmond, John Morgan, as well as William Shippen Jr. were all individuals who kind of took Benjamin Rush under their wing and helped him get into his field and his interests. So he was very prominent and well known. He made very many psychological contributions. Not all of them are exactly used today or proven efficient. However, at the time, they were very modern ways of thinking and really did some good for the field. As I mentioned before, he did not believe that mental illness was a possession of demons. He thought it meant that there was something actually wrong with the individual and that it was a disease. More specifically, he believed that mental disease was caused by an irritation of blood vessels in the brain. So he had many different methods to use to actually try to cure these diseases. One of them, I guess 4 of them, were bleeding, purging, hot and cold baths, and mercury. So he thought that all of these were ways to cure the irritation of blood vessels in people's brains who were mentally insane. He also designed 2 different mechanisms to try to aid in the treatment of the insane. The first is called the gyrator, which is the image to the right. And this instrument is kind of interesting. It was a contraption that the patient would be strapped to a board, and then the wheel that it was kind of attached to would be rotated at a very high rate of speed. And this would obviously send the blood racing to the head and was supposed to relieve the congested brain or the irritated blood vessels in the brain. So maybe not the most legitimate contraption, but at the time, Benjamin Rush believed that this was the way to curing mentally ill individuals. A second mechanism that he also invented was the tranquilizing chair, which is the image to the top left of the screen. This mechanism was also pretty interesting. It didn't harm individuals in any way, but it also, now we know, it didn't necessarily do any good either. It was basically, its only purpose was to hold bodies immobile for long periods of time, so the patient could settle down, and then the irritation of the blood vessels in their brain would also settle down. So they would basically just be strapped down to this chair, their head was covered. It was meant to reduce muscular action, reduce motor activity, and also reduce the force and frequency of the pulse. So again, it didn't really do any harm, but it also, now we know, it did not really benefit anybody as well. But this was a second mechanism that Rush designed and believed would in fact aid in the help of the cure of mental illness. On a side note, back to his method of bleeding patients, he really did believe this would help and would cure people of their diseases. He actually believed in it so much that he bled himself as well as a friend when they both contracted yellow fever. They both did survive, and after this bleeding, and of course Rush believed that it was because he had chosen to bleed himself and his friend that they survived. We now know that that is not necessarily true, but it was a leading belief at the time. So further of his psychological contributions, he did actually write the first systematic textbook in America about mental illnesses, and that was published in 1812 in Philadelphia, and the title was Medical Inquiries and Observations Upon Diseases of the Mind. Pennsylvania Hospital. It was said to be the nation's first hospital to care for the sick, poor, and insane who were wandering the streets of Philadelphia. And Benjamin Rush actually came to work as a physician at this hospital, and he saw some things that he really wanted to be changed. For example, the hospital had a tendency of chaining down patients that were that they believed were severely mentally insane, and Benjamin Rush did put a stop to that. He thought that chaining down patients was no way to help cure them, so he did put a stop to that, as well as people in the community would actually come to the hospital to view the mentally ill as a form of entertainment, which obviously is not ethical and should not happen. So that is another thing that Benjamin Rush did actually put a stop to while he was at Pennsylvania Hospital. So all in all, Benjamin Rush was a big contributor to many things in as far as the treatment of mentally ill individuals goes. He did try to progress the field away from more of the original thoughts that they were possessed by demons, they should be hidden away, they should be chained down. He wanted to kind of get away from that and find actual ways to help cure these individuals. He might not have always hit the nail straight on the head with his cures, but it was a step, and it was a way to help progress the field. And these are the sources that I used for my presentation, and that is the end. So thank you for watching.